Limb Lengthening for Achondroplasia, a guide for parents, by the world's most experienced limb lengthening surgeon. Hi, I'm Dr. Dror Paley. I'm the director of the Paley Institute. Since 1987, I've performed more than 12,000 limb lengthening surgeries, of which more than 1,000 were achondroplasia lengthenings. In more than 200 cases, these were for other dwarfisms. The Paley Institute is located on the grounds of St. Mary's Hospital. This is in West Palm Beach, Florida. You can look us up on paleyinstitute.org. St. Mary's Hospital has a surgical special care unit dedicated to the limb lengthening patient with special attention to adult and pediatric patients with achondroplasia. I'd like to introduce you to the Paley method of extensive limb lengthening. This starts as young as age 8 to 10 years, achieving 4 inches of lengthening of both femurs and tibias, and then repeats at age 13 with up to 6 inches of lengthening of both femurs and tibias. And then at age 14 or 15, 4 inches of lengthening of the upper arms, and age 16, again another 6-inch lower limb lengthening, for a total stature gain of 16 inches or 40 centimeters. The goals of treatment are to achieve normal height range. This girl went from 4 feet tall at age 13 to 5 foot 1.5 inches, shown here in comparison to her mother. Hyperlordosis is part of the goal of treatment. We correct this through stretching of the hamstring muscles during the lengthening and by a special extension osteotomy, which pushes the femur backwards during the lengthening, straightening out the pelvis and thereby the spine. Correction of bow-legged deformity is shown here as part of the goal of treatment, before on the left, after on the right. Both legs are straight after the treatment. Part of the goals of treatment is to improve reach. This is done by the arm lengthening as well as the stature lengthening. Restoring body proportions is important. Limb to trunk as well as limb segment such as femur to tibia or forearm to humerus are important. At age 13, this girl is shown before the lengthening next to her mother in 1988, and at age 16 in 1992, having achieved 5 foot 1 inches in height and normal proportions. Returning to normal function is the most important goal of treatment, and you can see how sports active this girl is. And then 23 years later, you can see a normal life in the city as she crosses the road here. I'd like to take you through 2 examples, one a girl, one a boy with achondroplasia, who went through the entire process of limb lengthening. This girl is shown here from age 1 through 7 prior to the limb lengthening. At age 7, she had her first limb lengthening procedure, achieving 4 inches in both femurs and tibias, or 10 centimeters. The x-rays are shown before, during, and after the lengthening, again achieving 10 centimeters in 5 months. The treatment time can be divided into 2 phases. The distraction or lengthening phase is the first 2.5 months of the 5-month treatment. During this time, patient uses a wheelchair but maintains range of motion of the joints through physical therapy and hygiene using showers, as well as performing pool therapy and physical therapy on land. The distraction phase is 2.5 months long, and the consolidation phase is 2.5 months long. This is the healing phase during which the patient is allowed to stand and walk with their fixators in place. After the fixator is removed, 5 months after the surgery, patient returns back to normal. You can see here doing ballet, running up and down the stairs, riding a bike, climbing, running, and jumping. These are normal children's activities that they can do even better after the lengthening. I'm taller. Look what I can do now. It was worth it, Mom. I'm not the shortest in my class any longer. These are typical quotes of children who've gone through the lengthening process. Compare her before and after as regards her sway back deformity, which is exaggerated on the left before the lengthening, and back to a normal posture after the lengthening. She's shown here with other dwarfs and also sitting on my lap. She's standing next to her mom at age 12, and then shortly after that she underwent the lengthening of the femur and tibia for the second time. We achieved 6 inches or 15 centimeters. During the consolidation phase, once again, she's able to walk around and participate in physical therapy throughout the whole treatment phase. Walking full weight bearing encourages bone healing during the consolidation phase. She achieved 6 inches or 15 centimeters of height gain. She's shown here attending school with her school uniform before the removal of the fixator, and then with her father presenting her with flowers right after the removal of the devices. Finally, able to sit with both feet on the ground instead of dangling in the air, as most achondroplasts are forced to do. After the second leg lengthening, but before the arm lengthening, you can see the proportion normality of the lower limbs to the trunk, but the disproportion of the upper limbs. Before the second lengthening on the left compared to after the second lengthening on the right 8 months later, the lengthening thins out the body by loss of extra fat and stretching out redundant muscles. This strengthens the muscles that never grew to their normal length. At age 13, she underwent arm lengthening. This was easy compared to the lower limb lengthening. She's able to go to school, do her homework, and be active. Here she's standing next to the patient that you saw earlier in the presentation at 5 foot 1 inches tall, compared to this patient who is almost reaching that height. Arm lengthening doesn't get in the way of normal activities, as she participates with her family in family vacations and other activities. Compare before and after the arm lengthening, showing the normalization of body proportions of the upper and lower limbs compared to the trunk. Finally, the third limb lengthening of the lower limbs at age 15, again achieving 15 centimeters or 6 inches. She's shown here in pool therapy. At her final adult height of 5 foot 2 inches tall, she's standing next to her mother. She achieved 40 centimeters or 16 inches increase in length. She's shown at age 16. We performed one more surgery to improve the scars, getting rid of the deep pin scars through plastic surgery. At age 18, she stands 5 foot 2 inches tall. Despite all the lengthenings, she was able to maintain high grades and was one of her high school valedictorians in 2011 at age 18, just before she went to college. She's now 5 foot 2 inches tall, and the tallest person in the picture is 6 foot 4 inches. She looks completely in place with other normal stature individuals. This boy was 3 foot 9 inches tall in 1999 with a diagnosis of achondroplasia. He was 10 years old, had marked hyperlordosis, and bow-legged deformities. After the first lengthening, you can see the straightening of the legs, and he achieved 10 centimeters or 4 inches in only 5 months. In April 2002, at age 13, he underwent his second lengthening of femurs and tibias, again achieving lengthening of 8 centimeters of femurs, 7 of the tibias, for 6-inch total increase in stature in a total time of 8 months. We rodded the femurs to prevent fractures, which is a normal part of the procedure. This was done in October 2002 at the time of removal of the fixator. At age 13, his height is 5 foot 1 inches tall. Total height gain so far is 10 inches. In December 2003, at age 13, he underwent bilateral humor lengthenings to lengthen his arms. We lengthened them 5 inches or 12.5 centimeters. He's finally taller than his mother at age 15. And his final lengthening was in October 2005, where we used newer technology using telescopic implantable limb lengthening nails for the femurs and the tibias. Through this methodology, we increased his height by a total of 6 inches or 15 centimeters. His final adult height is 5 foot 5.5 inches or 166 centimeters tall. All the goals of lengthening were achieved. Height, normal for his sex, 5 foot 5.5 inches for a male. Proportions, limb to trunk, femur to tibia, arm to forearm, all normalized. Alignment of his lower limbs, straight and normal. Function, his joints have full mobility, and he's sports active. His hyperlordosis has been corrected. Look at the comparison of his sway back deformity before on the left and after the treatment on the right. He's compared here to his mother at the original time of the before the lengthening, 1999, age 10, 3 foot 9 inches tall, and in 2005, age 16, 5 foot 5.5 inches tall compared to his mom, towering over her at that age. Another comparison with lines drawn to show you the relative height increase that he's made from 3 foot 9 inches to 5 foot 5.5 inches, part of which was normal growth. He kept a scrapbook of the lengthening process. And let me read from this. Welcome to my photo page. On these pages, I've included some of my pictures to illustrate how I was able to have fun, even though I had limb lengthening every year from age 13 to 16. It was hard, but you do get some breaks in between. Let's look at some of those breaks. New York Metropolitan Museum, 2004, age 15. Notice the external fixators on the arms. This is after 2 leg lengthenings. Miami, Florida, 2004. This was one of the first real summers I was able to relax and have some fun before the next round of lengthenings. Playing the drums, age 15, in the Bahamas. Cape Cod, 2005. My body looks very proportional. And with my friends at the FIFA World Cup game at age 17. Playing soccer at age 18. Playing hockey and lacrosse at age 18, just before going to college. At the Paley Institute, we bring smiles to the faces of children going through this growing experience. They make new friendships with other patients going through the same process. They don't go through it alone. They go through it with a class of other patients, shown here, the class of summer 2010. And the class is even much larger if you include all the patients undergoing lengthening for other causes other than achondroplasia. The Paley method achieves average height gain of 40 centimeters or 16 inches. All patients achieve goals of treatment. All patients return to normal function. The advantages include the shortest external fixation time of any method of extensive limb lengthening. Maximum lengthening per segment is minimized, thus minimizing the risks of the treatment. The risk of growth inhibition by lengthening at a young age is minimized by dropping the amount of lengthening at that age, and we minimize wheelchair time. In conclusion, extensive limb lengthening for dwarfism over the past 24 years at the Paley Institute can be done safely, reliably, and reproducibly. For further information, go to paleyinstitute.org. Thank you.
Thank you. Please stand by.